Assalamualaikum and hi class. Welcome to Healthcare Information System subject. Today we will discuss about the chapter 5 regarding the merging of EMR and Healthcare Information System. Before we talk about the EMR inside in detail, so it's better that we look at the learning objective of this chapter. So firstly is we want to enable you to describe uh, the purpose, use, key attribute, and function of some of the major type of clinical information system used in healthcare, including EMR, electronic medical record, electronic health record, and personal health record. So this medical record, three type of medical record will be discussed. Okay, and what we want to convey the message to you in this chapter uh, is to tell you that how important the generation of electronic medical record. Okay. Last or previous chapter we talk about the source and also how the electronic medical record or medical record is generated from the uh, processes in healthcare organization, yeah? In healthcare process or in the diagnosis process in healthcare organization. Okay, and then we talk about the computerized provider or the entry. So this is also the agent, the application that very important as a front end to generate medical record or electronic medical record, where this CPOE is a central of the clinical information system, where the patient, where the doctor order the clinical support entry, such as a drug, test, and examination. And then we talk about medication administration, how the drug is managed and how the treatment is managed in the ward or in the episode. And we talk about telemedicine, telehealth, and prescribing. So this is among the application that contribute to the generation of electronic medical record. So this chapter also try to enable you to define the key component of EMR system and the current status of the system. So when we talk about the healthcare information system, so we should relate with the EMR, yeah, electronic medical record, uh, and then EHR, yeah, electronic health record. So in Malaysia perspective, they call it LHR, yeah, lifetime health record. So this is important key when you involve in this industry, ICT, in healthcare. So you need to visualize that. Okay, when you start this project, so you first thing that you need to consider is the electronic medical record. How you can generate, store, retrieval, and upkeep the data. Another objective of the learning of this chapter is to be able to discuss. We want to student to able to discuss the major barriers to EMR and EHR adoption, yeah, and the strategies being employed to overcome them. So EMR or EHR is not easy to implement in the big organization like hospital. Yeah. There are many barriers, and of course the adoption or change management need to be done properly for get the buying in from the healthcare workers, especially the doctor, nurses, and other administrative And lastly, we try to uh, we try to uh, make it the student to able to define health information exchange. How the healthcare information can be transformed from one organization to another organization, or from one doctor to another doctor, or from one department to another department. And uh, and you also need to know how to uh, make it the health information to be shared across the country or across the state in the country. Okay, so electronic medical record, when we talk about system or application system, uh, the ultimate goal is to get the data. Yeah, so you store the data, uh, whatever system that you develop, either banking, uh, insurance, uh, education. So the main goal is to collect the data, yeah, to collect the data, store the data, and retrieve back the data, and manipulate the data to get the reports. So patient medical record are used by healthcare organization for documenting patient care. Yeah, they use the medical record, patient medical record system, or EMR system. We will always use electronic medical record is a record. So when we talk about electronic medical record system, is a system that support uh, the generation of the electronic medical record. So normally the healthcare organization use the EMR system for documenting patient care, document their patient demographic, document their clinical finding, document uh, their financial matters, document their uh, referral letter, appointment, manage the appointment, and etc. And patient medical record uh, is used as a communication tool for those involved in the patient care, and to support administrative activities, reimbursement, and also the research. When we talk about electronic medical record, it's owned by the patient. Yeah? So that means the electronic medical record uh, is generated by the patient. So then we call patient medical record or patient health record. So like I said just now, it used as communication tool. Why? Because when you want to send the patient to the doctor, so patient medical record is a main document. Yeah, it's a main document for you to forward to the doctor. Yeah, right after you register the patient, so you already keep the patient information, and then you send the patient information to the doctor, and the doctor open the patient medical record of the patient. So this is a electronic medical record become a media, yeah, a tool to communicate uh, between healthcare services within the hospital. So anywhere you go in the hospital, so the service department will ask you the patient master index number, right? Or where they use the your IC number. So the IC number will retrieve your medical record in electronic medical record database. So most patient record have been kept and are still kept in paper form. Thus brought many challenges in providing best healthcare services to the patient. So you remember that when we in the chapter before. Yeah. Okay. So not all hospital, yeah, keep their patient medical record in EMR system, or in EMR uh, database. Okay, maybe this is a this is a example where you convert from the manual process to the computerization application. Okay, so some of the hospital they don't have this application, so they still use a paper. So this is a problem. Yeah? If the hospital, some of the hospital use EMR, some of the hospital is still use MR only. Yeah? They don't use E. Sorry, I have to go back to the previous. Okay, the medical record are often illegible, incomplete, or unavailable when and where they are needed. So this is according to Gani MKA. So I wrote one paper in the journal. It's one of the paper that I discussed about the issue of medical record, which is always incomplete, always fragmented, and always unstandard. Yeah. So you can refer to this paper if you want to read more on the detail of the discussion in this journal. So you can go to the in the sign online and then check this paper written by me in 2008, I think. Yeah. Okay. Healthcare provider need access to active tools that afford them clinical decision support capabilities and access to the latest relevant research funding, reminder, alert, and other knowledge. So electronic medical record is very, very useful when when it store in systematic manner and then enable the healthcare provider or health worker to retrieve back where this data when it become big and we consider that electronic medical record as one of the big data, and then we can use them uh, to be knowledge base for the clinical decision support system. Yeah, and it can be used for reminder, early warning system, such as COVID-19 early warning, yeah, dengue, epidemic case. All these can be uh, used from the electronic medical record, uh, which yeah, which store in a proper way, and it is very useful if this electronic medical can be generated by all hospital across Malaysia, for example. Yeah, so we can get a lot of benefit from that. So medical record of the future will likely become critical as one of the critical to accurate diagnosis and treatment. Yeah, of course. When we talk about healthcare, it's data intensive. So when you go to the hospital, the doctor will first refer to your past medical record. So electronic medical record is a medical record uh, is collect from the consultation, testing, and so on, and become a reference to be as a tool for the doctor to diagnose your problem, the patient problem. So what I want to say here is electronic medical record is very important uh, in the healthcare information system. Without EMR, if you run your system only the function and then you unable to keep the record, then you waste the money to develop the application. So in general, when you look at the EMR, how EMR is work, or how EMR is generated from the application here. See, okay. So this is a fundamental of the EMR, yeah, or we call it fundamental system. When we talk about healthcare information system, so this is a application of SRS need to be developed. So this we call it MVP, yeah, minimum viable product, in order to generate the EMR. So normally this application facilitate the healthcare facility. Yep. So this is one example. Yeah, his is one of the example of HIS application uh, that consists of various module to manage the healthcare facility. When we talk about healthcare facility, either clinic or hospital, yeah, the organization that relate to the healthcare provider, so we call it healthcare facility. So you see that when patient to go to the visit the hospital healthcare facility, so doctor will attend the patient and they start use one or more than one system in this in the system suite, yeah. So of course the doctor will use a CIS before doctor is sent to the before the patient sent to the doctor. So this patient go to the PMS, right? So they do a registration, and then the registrar send to this patient to this doctor, and then this doctor will open the CIS and they will order the uh, lab test. For example, they will order the imaging examination, okay? Or if the patient require acute treatment, so the doctor will send to the ADT, yeah, admit discharge transfer in the ward, okay. And then if the patient require urgent treatment, medication, so doctor will send the order to the uh, pharmacy, yeah. And finally, when the patient discharged, then they will go to the billing department and pay the fees. Okay, see, this is a process how the EMR uh, created, yeah? How the EMR is created. So his care is one of the application that I developed, yeah, for managing the hospital, yeah. Uh, okay, so when the phase one is a healthcare facility application, yeah. When this system is developed, so you need to think about the data structure of the EMR. That's why in the previous chapter, I teach you how to develop the EMR or EHR. Uh, okay, forget for EHR first. Focus on the EMR. So I teach you how to model the ERD of EMR. Yeah? So you need to define the data structure of EMR. You see that these two components is very important. When once you develop the EMR system, so this is a EMR system, to generate the EMR, yeah, electronic medical record. And then when we complete this two big system, so the EMR will extract the summary, and then we create the EHR, we call it. So the EHR is a summary of EMR. So EMR is the entire record, or record that generated from the healthcare facility, uh, from the healthcare activities, for certain healthcare facility. So that means EMR is a facility based. So that means, for example, hospital A, they got their own EMR. Yeah, hospital B, they have their own EMR. Then the various EMR from various hospital is transformed to EHR. So the EHR purpose is to make it uh, scope bigger than EMR. So maybe hospital A require EHR record for Aminah, for example. So they can refer to the EHR, which is located in the national level. Okay, then the EHR is become big, and we consider that the data is considered as a health data warehouse. A big data and analytic function will play a role here. Then after the big data and analytic is generated, or health data warehouse is generated, so the data can be personalized by the patient. What is the personalized health? Personalized health record is where the patient can upkeep their health record by themselves. They can enter their blood pressure, their glucose. They can put a plan, and then when they visit the hospital, uh, see the doctor, and then the doctor can view their personalized health record, which is input by the patient. And then finally, not finally, and then once the data is there, EMR is there, health data warehouse is there, and it is easy for us to do a telemedicine and teleconsultation application. Yeah, so wherever you go, so the doctor can use the telemedicine and access your personalized health record or your EHR anywhere and anytime. And finally, uh, we call it virtual hospital. So this is a very what they call it, very futuristic uh, thinking about the hospital. Uh, we only can have this virtual hospital if our data of EMR and EHR can be implemented in all clinic and hospital, uh, for example in Malaysia, across Malaysia. So this is a picture, the blueprint, uh, to give you the overview how the EMR is played a role. So EMR is actually generated from the healthcare facility, and from the EMR uh, it expand to the EHR and personalized to the specific person or patient, and it can be used for health data warehouse, for analytic, projection, promotion, preventive, and so on. Yeah. Okay, back to the our slide just now. Okay, this is different between EMR, EHR, and PHR. So like a diagram or uh, blueprint that I show to you, I think you can differentiate between EMR, EHR, and PHR. So I highlight here EMR is a one healthcare organization like this one. Okay, one facility, healthcare facility, they have their own EMR. Okay, so when we talk about EHR is a electronic record of health related information on individual that conform to national recognized interoperability standard, and that can be created, managed, and consulted by authorized clinicians and staff across more than one healthcare organization. So see from this diagram, okay, the EMR is generated from various hospitals, and it become the central in the country level. Okay, so anyway, to get the EHR, so the EMR must be complete. Okay, and personal health record and is a electronic record of health related information on individual that conform to national recognized. That means it should be conform with the standard of national uh, recognized interoperability standard, and that can be drawn from multiple sources while being managed, shared, and controlled by the individual. So that means the patient own the record, yeah. Uh, but when the patient visit the doctor, so the personalized health record and EMR will be reconciled, and then it will merge. Okay, so a lot of personalized record is a vital sign, for example, and then maybe you can maybe some of the wellness program, okay, can be entered here. So when you met the doctor or when you meet the doctor, so doctor will check the progress of, for example, stop smoking. So you need to key in activity progress of your stop smoking program in the system. Okay, so this is different definition of EMR, EHR, and PHR. When you talk about the EMR, okay, when you got a task or project for healthcare information system, and then you are in the discussion meeting. So when the consultant talk about the EMR, EHR, and PHR, so you can position yourself. You know what to argue, and then you know what to share the knowledge with the team. Okay. So this chapter is actually talk about the electronic medical record, uh, because uh, without the EMR, electronic medical record, so the healthcare information system cannot be functioned accordingly. Yeah. So because the purpose of the healthcare information system, which is consists of a lot of healthcare information system application, uh, is to generate the electronic medical record. Yeah. So the function of EMR is actually to store the health information and the data. So the EMR uh, contains contains the health information such as nursing diagnosis, medication list, allergy, demographic, clinical narrative, and laboratory test result. And EMR also keep the result. Result. So EMR considered a tool to manage the result, such as the laboratory test result, radiology examination result. Yeah. So this is a second function of EMR to manage the result. Any test done in radiology or laboratory, so the result must be recorded, because the result is important information for the doctor to diagnose certain problem of the patient. So EMR function uh, is uh, to order the request. Yeah. So when the doctor order the request, for example, request for test, uh, imaging examination, and also the medication, the drug. So the EMR is a tool to send the request and receive the request. Yeah. So what we want to mention here, so the EMR is useless. Yeah, useless if we don't have the order entry management. Okay. So when you develop the system, so you should consider that you should put the priority, so the doctor or health worker can order the request to the uh, service department. And EMR function is to help the doctor to make a decision. So the EMR uh, provide a tool for decision support system, DSS. It employ the reminder, for example. So from the EMR record, so the application that having a decision support system algorithm, so they can produce the reminders, alert, computer assisted diagnosing, and so on. So this is among the function of EMR. And EMR also used as electronic communication and connectivity. So it enables those involved in patient care to communicate effectively with each other and with the patient. So technology to facilitate communication and connectivity may include email, web messaging, and telemedicine. As nowadays, doctor also use WhatsApp to share the information of the patient, share the test result, share the image of the examination from one doctor to another doctor. Okay, so EMR also as a tool to support the patient. Tool to support the patient means provide education material to home patient and used by the telemedicine system. So like this one, like I showed to you just now. So you can share the journal or article regarding one problem, for example. So the doctor can forward the information to the patient. Okay, another function of EMR is to use as a tool for administrative processes. Yeah? Facilitate and simplify such processes as appointment, roster scheduling, billing, insurance verification, and it also employ decision support tool to identify eligible patient for clinical trial or chronic disease management program. And lastly, not least, the EMR provide a report, establish the standard terminology and data format for public and private sector report requirement, statistic, research report, and so on. So when we talk the EMR, it's not only the data. So the data, that's why uh, I start the this program or this subject with introduction of the application, introduction about uh, the key application or key system uh, in healthcare information system, yeah? Like patient management system, clinical information system, LRS, and so on. That is the agent, agent to generate the EMR record. So EMR is not only record, because EMR is generate to transform data to the knowledge, yeah, and then this knowledge can be used to uh, make a decision about the patient. Okay, this is a common hospital information type to support EMR generation. So from the application perspective, uh, what is the his type, main his to support the EMR generation? First, of course, patient management system. Yeah, so patient management system involve patient demographic, emergency department, outpatient department, inpatient department, registration. Yeah, so when we talk about registration, is this system will deal with the patient demographic, patient biodata, patient next of kin, patient uh, health insurance, yeah, and regarding on the referral, appointment, ward, who will stay in the ward? Of course, the patient. So we refer to the patient biodata, yeah. And then when doctor want to uh, attain the patient, so of course they will request the patient demographic first, and then they will zoom to the clinical detail, uh, medical record. And then another common HIS type is a clinical information system. So this is a consider a core system in the HRS, where this system will be used by the health worker, especially the health worker professional, a doctor, specialist, nurse, to manage the clinical notes, reports, finding, diagnosis, investigation, assessment, plan, and procedure. So all the clinical data will be captured through this system. Another HRS that support EMR generation is clinical support system. We call it clinical support system uh, to all the service provider who provide the lab test, for example. Okay, lab test is responsible by the laboratory, yeah, laboratory department, where the laboratory department use the LRS, yeah, lab information system, to receive the order, to generate the specimen number, to what to perform the test, to key in the results, yeah, and then to submit the result to the requester. Same also to the RIS. RIS is categorized under clinical support system. Why? Because RIS, radiology information system, eh, under the radiology department, provide a service to the clinical finding, to a clinical investigation regarding examination of image. And PHRS, pharmacy information system, is one of the clinical support system where the pharmacy use the pharmacy information system to manage the drug order, to manage the drug stock, and then to manage the drug to be dispensed, to be scanning, and so on. So when we talk about the service to the clinical investigation, uh, we call it the clinical support system. let's say we have another service, or they call it OT, yeah, operation theatre. This consider clinical support system also. So they have CCIS, they call it clinical. No, they call it critical care information system. Yeah. So that system normally in operation theatre, and also they have a special ward, yeah, to manage the uh, critical patient. Okay. Another common HRS type is a human resource and financial information system. So this is common system to administer the people and also the money. Another common is, HRS type is a supplies or stock management system. So supply is a non-drugs inventory, or stock. For example, bandage and so on. And common HIS type to support imagination is a reporting, statistic, analytic, and executive information system, and also the operational activity, which is generate the statistic and can be saved in the EMR record. Okay, this is a common HIS type that you should know that, and you should prioritize when you develop a system. So this is a six module, six main system that need to be developed or need to be have when you want to computerize the healthcare providers, healthcare organization. Okay, we go to EMR current adoption and use. So before we list down what is the barriers and challenge in in uh, in implementing the EMR system in certain healthcare providers or organization, so I like to bring you all to one case study on the ICT development or ICT initiative in Malaysia perspective. So ICT enabled healthcare facilities in Malaysia is when we look at the numbers, so we more or less we have 145 hospital, which comprising of 35 hospital with HRS and 105 hospital without any HRS. Without HRS mean without EMR, without EMR system. So they don't have computer system. So only 35 hospital out of 145 in Malaysia implement HRS. So you see that very long gap with the developed country. So we still struggle to computerize the hospital with the HRS. So when you look at this data, especially on the KK and KP. KK mean health center, like in Malacca they call it polyclinic Aikro. That is a KK, klinik kesihatan in bahasa Malaysia. KP is a klinik pergigian, is a dental clinics. So KK and KP total is 1,703 across Malaysia. But if we compare in India or Pakistan or Bangladesh, I think your country is more number than us, I think. So from 1,703, so 118 only implement with the CIS or HIS. Another remaining of the clinic kesihatan or klinik pergigian still in manual. Okay, when we look at the service and workload mean we look at the numbers of the patient visit per year. So based on the, you see at the hospital, bed occupancy rate in 2015, state hospital having a lot of patient admitted. 81.53% from the admitted patient is happen in the state hospital. And major specialist hospital, for example, the specialist hospital, Hospital Melaka, for example, Hospital Muar, Hospital Putrajaya, Hospital Sedang. So the numbers of patient is less than state hospital. We stand at 78. So specialist hospital 62, non-specialist hospital 48%, and special institution is 57.41%. So meaning is that the workload is happen in the state hospital. Because all the district in Malaysia refer to the state hospital first before they refer to the specialist hospital. For example, Hospital Jasin, we refer to the Hospital Melaka. After Hospital Jasin cannot handle the case, so they will refer to the Hospital Melaka. So when Hospital Melaka cannot handle the same case, so they will refer to the Hospital Kuala Lumpur, for example. So Hospital Kuala Lumpur is under major specialist hospital. Minor specialist hospital is based on the cluster, based on the specialization. For example, Hospital Putrajaya focus on the cancer. Maybe Hospital Johor Bahru focus on the orthopedic, for example. They're based on the specialization. So we look at the clinic in Malaysia based on the attendance per year, which are separated into, you see that clinic kesihatan. This is a healthcare center such as health center Alor Gajah, health center Duren Tunggal, ICRO. So average every year is 42 million the attendant, and this is dental 12 million per year. Okay, we look at the hospital application status. So what are the ICT initiative currently done in hospital across Malaysia? So HRS KKM is in development and expected to go live on 27 April. So pharmacy and CPS KKM has been rolled out nationwide to all 145 hospitals and 943 health center. So this is a pharmacy information system is lead, but this is pharmacy only. It not cover with the CIS, the clinical portion. So the pharmacy is only store, right? Very easy to implement. So it less beneficial. It less information about the patient medical record. It's about drug information only. So LIS KKM is also expected to go live. OTMS KKM is in development. CSSD KKM is under development. So RIS, BBIS, CCIS is a critical care information system to be developed, to be deployed in 11 state hospitals. So this is an effort currently done in Malaysia Ministry of Health, public hospital. Okay, this is a current hospital application and deployment across Malaysia. So you can see that there are four, sorry. Cerner, this is Cerner is a US product software. Physicians, Stratec. So this is I think, I don't know, this is Singaporean company. And iSoft, this is a Indian software company. Prof Doc, I don't know, this is also from Singapore, I think. only one hospital use in Bintulu. SPP and SPPD is application that manage the patient management only, yeah, manage the patient registration. This is a manage patient outpatient registration, manage patient inpatient registration. So these two application is developed in-house by the uh, IT center of MOS. So you see that only 11, 16, 16, 18, 19, 20. 20 hospitals only implement with the EMR system or HIS. So the rest still uh, manual. Yeah. So clinic application status. So yes, they have progress, but they try to implement. They call it TPC OCHIS. So this is different. Yeah. So this HRS hospital implementation. Sorry, hospital information system. So this is a very big system. They call it total hospital information system, and they use a different application for clinics. By right, the same application could be used by all healthcare facility. So this is another problem. Yeah? So it will bring another problem of integration. So you'll see that uh, non-system 1585. So so not much good progress. Although they develop a new system, they call it TPC or CHIS. Yeah, tele primary care oral health care information system. So this is a combination of dental and clinical system. Okay, see 7% only implemented with the EMR system. Uh, in terms of infrastructure and security and facilities, so currently hospitals that have been implemented with HIS is equipped with a physical server. So they have their own server. So all hospitals that implement the EMR system using dedicated server, dedicated infrastructure. So they don't uh, use a cloud-based application yet. So network bandwidth range VSAT, VSAT IPME technology. So VSAT I think used at the used at used in Sarawak, I think Sarawak and Sabah, because of the geography constraint. And almost the hospital that use the HRS equipped with WAN, security policies, management, and IT operation. These are standard. Okay, what is the issue? Currently, more than 75% of the hospital and 90% of the clinic in MOS are still using manual recording system, paper-based without IT system. So you look at this figure, 75% and 90% of clinic still manual. So there are a lot of opportunity for you to innovate and to develop a very develop affordable system to be used by MOS in their healthcare facility. So I don't discuss about the cost yet. Yeah, when you look at the cost to implement this hospital in Selayang, Serdang, so you will be surprised. So one hospital involve multi-million cost. So you as a software, I think you need to innovate, provide a good solution, a cheaper solution for our country to computerize this one. 75%, 90% of the healthcare facilities still on manual. So there are many opportunities for you to innovate, give the idea how to provide a best solution with a affordable price for the software. So with regard to this manual paper-based medical record, so hard to keep up with the high workload using manual approach. Difficult to access patient information. You cannot search. You have to go to the uh, uh, record department to get the patient information. And some of the existing infrastructure and network facility capabilities are hampered by the following outdated ICT equipment. Some of the hospital are very old, uh, especially the health center, no bandwidth, no internet. So this is some of the hindrance, some of uh, the rejection of implementing the EMR. So I think this is the infrastructure need to be upgraded by the government by using the uh, what they call it a new technology of internet. Okay. So what is the way forward of Malaysia healthcare information system? So the way forward of Malaysia healthcare information system is to get the centralized lifetime health record, or you call it electronic health record. And for Malaysian, I think when you go to the healthcare center or hospital in government hospital, they call it record kesihatan sepanjang hayat. So this is a ultimate goal or way forward for Malaysia healthcare information system uh, to reduce the cost of managing the patient, the cost of maintain the to reduce the healthcare cost every year by generating the lifetime health record, where this lifetime health record or EHR record can be generate a prospective or promotion healthcare information, so that this record can be used for managing uh, for use for to be used for wellness program and so on. Okay, and another way forward is to develop an integrated healthcare ecosystem involving both the public and private sector as depicted in the below diagram. So this is the way forward of Malaysia. So this is their vision to get the integrated healthcare system, healthcare information system across private and public hospital, and especially to generate the lifetime health record or medical record for patient. Okay, I think this is important view uh, for foreign students, so you can view your country status of healthcare information system. Look at the go back and ask your friend or your relative in your country, asking about the you need to ask about your country healthcare information system status. So you must find that of course the developing country or the poor country, this HRS is still behind compared to the developed country. Okay, finish. We look at the current relation and use of the HRS for the Malaysia perspective. Then we go to the other major healthcare information system type. So this is a major healthcare information system type, CPOE. So this is an example of CPOE, for the entry for radiology, laboratory, drug, procedure, surgical, and so on. Yeah. Okay, barriers and challenge to adoption of EMR system. Of course, first is a financial. For developed country, they don't face any problem on the financial. So that's why, example, UK or England. So all those it take a longer time to get a centralized electronic health record across the UK, but they finally they achieve from 2000, and they have implemented uh, in 2012 the health information system across the England or UK. So a healthcare organization might invest a significant amount of money, personnel, and other resources in an EMR system, and yet not realize a positive financial return on its investment. So this is normally uh, the dilemma of the healthcare organization when they invest in the EMR system or in HRS. They not sure whether they can get a lot of patient or the loss of money because of EMR system. So this is why some of the organization, healthcare organization, still use the manual system. Yeah. Another barriers is behavioral barriers. Behavioral or organization barriers impede the adoption of EMR system and other clinical information. So this barrier can be equally difficult to overcome as the financial barriers because they include everything from lack of position acceptance to change in flow in workflow to differences in state licensing regulation. So I think the behavioral barriers is more tough compared to the financial because behavioral barriers you need to build the culture. You need to change the culture. You need to increase the motivation of the health workers to use the EMR system. So you need to change the way they work from the manual system to the new system. Of course, a lot of chain management need to be done to change the way how they works by using the EMR system. So another barriers and challenge is technical barriers. So technical involves technology where healthcare organization must implement the technology necessary to support and sustain the EMR system. Yeah. Uh, let's say hospital A use very old technology of hospital information system. So this is very difficult uh, to make the system scale when the business process of the hospital increase. So of course the HRS information system, healthcare information system, need to enhance and cater the new process for the healthcare organization expansion. So technical barriers to establish health informatics standard is not easy. Yeah. So you need healthcare, you need the medical expertise and also the ICT expertise, and you need to marry together. So from my experience, I require 3 years to understand the medical aspect in terms of health informatics. So we need to learn the communication of medical people. We need to learn the medical system, the terminology, the classification, yeah, used by healthcare workers across their uh, processes within the hospital, between the uh, department or service department. So another barriers. So this is another tough or challenge thing need to be resolved when you want to implement the EMR system, or if the EMR system need to be adopted in a certain healthcare organization, is people mindset. And some workers ingrained with legacy way of doing day-to-day processes and complacent with it. So this is difficult to change. Yeah. Let's say you already ingrained with the manual system for 20 years, and tomorrow you want to change to the technology, use new technologies or devices. So this is very difficult to change. Paradigm shift is very difficult uh, on these changes. Yeah. So inadequate champion and leadership in health informatics. So this is another barriers. Uh, when we when you want to develop like such a big system like healthcare, so you need a champion and leadership in health informatics. So this is important why I I brought this chapter or this subject to the student to learn the healthcare information system under health informatics uh, area. And to resolve the people mindset, so we need a training, change management, uh, and this training and change management need strengthen the way how the training and change management to be conducted. So we cannot use a whole type of training or change management. So we need to bring the uh, medical people in the training, and hopefully the medical training can provide the medical people can provide the training on the system. So the health worker will appreciate. So if the ICT people without the health informatic knowledge, and then they will do or conduct the training and change management, so I don't think that the health worker will appreciate the training and also the change management program. Yeah. So that's important that I told previously. The champion and leadership in health informatics is very important. Okay, in summary, EMR, EHR, PHR are patient health related information used by the healthcare professional in a specific purpose, location, and organization. So remember, yeah, so EMR, EHR, and PHR got their own purpose and got their own locality to be assessed and to be stored. Okay, so EMR adoption support by common and innovative HRS applications such as PMS, CRS, LIS, PIS, RIS, CPOE, television, mHealth, and etc. Malaysia current state in HRS is still under development and finding way towards to sustainable and integrated solution. And EMR barriers and challenge involve financial, behavioral, technical, and people. So not only application, yeah, you have to put your focus and put your plan when you want to develop the healthcare information system. The most important thing, uh, the most challenge come from the people, yeah, people or health workers inside the healthcare organization. So I think you need to strategize when you want to develop healthcare information system for certain healthcare organization. So you need to bring the medical people uh, to handle on the aspect of people mindset. Yeah. Okay, class. I think it's quite lengthy this video because we talk about the adoption. We have to bring the case study of Malaysia so that you can appreciate what is the EMR and what is the challenge in implementing the EMR, what is the element need to be prepared for EMR adoption by the health workers. So I think that's it. See you later. Thank you very much. And Assalamualaikum.